Okay. So our first speaker is our patient speaker. So Bob Schuett has kindly agreed to come in tonight and tell you a little bit about his story. Bob has been involved in the construction industry for most of his working life prior to becoming a lawyer, and he now practices law here in Calgary. He's a longtime resident of Calgary. He's married, and he has 6 children. I bet that's kept him busy. Actively involved in his community here in Calgary and in various industry organizations for many years. So please join me in welcoming Bob Schuett.
Thank you very much. As Joan mentioned, I've been a longtime resident of Calgary. I'm a relatively new lawyer. I've been a lawyer, in fact, 10 years today. This is an important anniversary for me. And at the same time, we're celebrating the beginning of articles for law for my youngest son. So we've got a lot happening today. So talking about my cancer adventure, that's the way I think of it. We go back to the beginning of 2010, and I had a little problem with my heart, have a couple of stents, and but by and large, I was feeling pretty healthy. And to that end, I was going through a bunch of medical visits with doctors and so on, so I could get my pilot's license back. So I was visiting my aviation doctor, and everything was going great. You know, I could see, I could hear, you know, all the things you look for in a pilot, and a private pilot. And his nurse came in, and she said, Mr. Schuett, you've got a little blood in your urine. And I said, yeah, I kind of noticed that, but I'm going to go see my family doctor next week. Oh, okay. And off they went, and he signed off on my medical certificate for my pilot's license. I never quite made it to an airplane. By the following Monday, there was more blood than there was urine. And by Tuesday, the pain was so excruciating, I literally couldn't walk. I went to emergency. They gave me pills. My doctor gave me pills. They gave me more pills. They said it's probably a kidney stone. And I said, yeah, I see somebody nodding. And that seemed totally reasonable to me. I've had friends have kidney stones. They're very painful. They go away and everything's fine. By Wednesday, it was so bad, I had to go back to the emergency, and they said, yeah, it's probably a kidney stone, and here's some more pills. But this young dude, young doctor, he said, you know, just to check you're going to be able to pass it, we'll give you a CT scan. And that was fine. So one of my daughters was with me, and this doctor comes back, and he's whiter than I was. And he walks up and he says, can we go in the other room and talk? So off we go into the other room. And he said, it's not a kidney stone. You've got a tumor. You know, that's a T word. That's like the C word that we don't ever hear, right? When you're first diagnosed, nobody wants to say cancer to you. But anyway, that's what they said, and he said, you're going to be meeting a urologist tomorrow. And that I did. He said, yeah, you've got a tumor. I said, is it cancer? Well, we don't know yet. Tumor was that big, you know, like, I don't know. Anyway, I was trying to get some feeling of whether, you know, what this really was. By the time I finished with him, he had never said the C word, but I knew I had cancer. I ended up, he said he'd try and get me in for surgery on an expedited basis. By Tuesday, by Saturday, I couldn't do anything. By Saturday, I was almost doubled up, went back to emergency. They admitted me. Tuesday, they took out one of my kidneys and a big tumor, and so that was done. They discharged me Friday, and the following Tuesday I was back at work. So I have lots of good things to say about the Alberta Health Services in Calgary and the people down at Rocky View Hospital. They took it out, patched me back up, and I was back working again, albeit with some discomfort from the operation, but I was able to function. The biggest problem I had with the operation was this huge pain down my left side. Because of my heart problems, I was really quite concerned about it. And I bugged a bunch of doctors for months on about what caused it. One thing about having cancer, of course, is you get really great drugs. So I was doped up enough so I could deal with it. But I later found out it was probably because I was lying on my side for 6 hours during surgery, and I had some nerve damage. If you've had that happen, it goes away gradually, but it does go away. My urologist also recommended that I participate in a drug trial. And I thought about it and said, that sounds like a really good idea. I think it's a positive thing to do. Not only do you better your chances of recovery in the long term, but the other thing is, once you go through the system and you draw on the resources of it, I personally believe there's a little payback you can make. And if you are a patient that qualifies, it's probably a good idea to try and help out as best you can. So I spent 14 months on a drug trial, and that had its own interesting aspects. The side effects of the medication are really quite difficult to deal with. That's the best way I can put it. In my case, because I just started up a new law practice and it was small, I couldn't take time off, so I had to work every day through the process. I was able to do it because I have a very understanding family and a very helpful family, plus the people I worked with stepped up and helped out as best they could. That support network is the thing that made it, I won't say easy, but not so difficult for me to go through that 14 months of medication and so forth. The other thing is, of course, when you're going through that, I'm a pretty up person. I'm not subject to being down a lot. But I found that it was pretty tough for me to stay positive for that period of time. You've got this underlying thing in the back of your head about whether you're actually going to, hit that 5-year mark. So that always worries you, even if you are an optimist like me. Every time something goes wrong, you stub your toe and you think, oh my God, is it back? And it's human nature, but you do it. What I found is the people that supervised the drug trial I was on, Dr. Heng, and the nursing staff here were very helpful. The thing I learned is you have to go in and you have to ask questions and make sure you understand what's wrong with you, how it happened, what the medication does, and so on. It's a lot easier to deal with if you really know all that stuff. If you go back to when you were a kid, you took the flashlight and looked under your bed for the ghosts and goblins, and you felt you could go to sleep then. Well, that's the same sort of thing. If you know what's happening to you, and you know why you can't eat, and you know why your mouth is so sore, it's a lot easier to, once you have that knowledge. So I'd encourage you, if you're in the process of going through what I've just described, to make sure you ask those questions and don't be shy about it. The people that you're dealing with, number one, they've heard it before, and number two, they know the answer. Number three, they want to tell you. They just want you to ask the question, that's all. I guess that's pretty well my story. I'm now, 10 months, 11 months after the end of my drug trial. It took me 6 months after the drug trial before all that nonsense flushed out of my system and I felt normal. Prior to that, I was tired a lot, and so forth. During the drug trial, I was working. I'm a lawyer. I have to be responsible. I would not meet with a client alone. I certainly wouldn't be driving a car when under the effects of the medication. Bottom line is, it is possible to work while you're on this. It's difficult. And if you can't do it, don't be embarrassed by the fact that you can't, because it really is a drain on your system. Okay? Well, thank you very much.
Perfect.
5 minutes? 10 minutes.
Thanks very much, Bob, for sharing your story with us.